Hi, Tamsin. So this one person died within the last week. All health officials here in New York City are saying is that that person is over 50 and was not diagnosed early. As you said, we have 18 total cases in this outbreak that is contained within the northern Hamilton Heights area and southern Washington Heights, from river to river. So it's a pretty large cross section. We have 7 people who are still hospitalized, and it's important to remind people that the Legionella bacteria is not contagious from person to person. Health officials have been focusing on those cooling towers. We've been talking about them over the last few years. Every time we see one of these outbreaks, the bacteria grows in the mist, in the cooling towers. And so we have a cluster here in this area. 20 of those cooling towers on top of buildings have been inspected. Health officials are not saying exactly how many of them have been problem cooling towers, but they are saying that they have dealt with the ones that they believe contain the Legionnaires bacteria, Legionella bacteria. We spoke with health officials. We spoke with people who are living in this area. Listen to what they have to say about their concerns and what they believe is the cause of the spread. Just a technical question. So first, is Legionnaires able to spread from one infected cooling tower to another? And secondly, why do you think you have so many issues with these cooling towers in such a concentrated area?
So Legionella would get into a cooling tower because it's just ubiquitous in water. It's everywhere. So it's not impossible to imagine that there's a way that mist from one tower could influence the other tower, but that's probably not the common mechanism, the common way the Legionella gets in the tower.
I lived in the neighborhood a long time. So yeah, they had a meeting at the church over here the other day, and it definitely has me concerned. My kids live in the neighborhood too, and it's something that I hope the city gets on top of.
Okay, so here's why health officials here in New York City are optimistic. The incubation period is 2 weeks. They haven't had any report of anyone getting sick since last week. So if you're looking at your calendar, health officials are saying that if we do not have any new reports by next Wednesday or Thursday, they can at that time begin to say that this cluster is under control. Fingers crossed. Until then, they're reminding anyone, if you have any pneumonia or flu-like symptoms, do not wait. Go to the doctor, especially if you have come into this area of northern Hamilton Heights or southern Washington Heights, or if you've crossed through this area. Again, pay attention, be proactive, go to the doctor. Until then, fingers crossed until this next week. We're live in Hamilton Heights this evening. Jay Dow, Pix 11 News.